Hey, Craig, man, give me some of those soulful keys, man. See, I want to represent that hope, man. I want to empower the people, man. Uplift the people, man. You know, sometimes I know life could be challenging, gets you down. Sometimes you want to stay down. But I want to be that hope, man. So I want the people to believe. Out the slums, don't get down in the dumps, get pumped for this life. Come on, stand up and fight. Don't take it laying down or even think of tapping out. Tell yourself you're making it, don't think of backing out. Rise and shine like you were meant to accomplish something great. Don't listen to the hate, cause your fate is what you make, cause it's strong enough. You need to know that you are strong enough. You need to know that you are strong enough. Know that you are strong enough. It's like knowing without knowing. Reach deep inside your soul, pull a rabbit out your hat and make a habit out of that. Make a choice to never.
So here we are celebrating the 25th year. Can you imagine that? We have come a long ways by the guidance of Grandmother Moon and all creation, our Mother the Earth. And how we are to restore our being, because we started a long time ago. We were proactive. We were getting ready for the changes that was to come. And as a result, we have done a lot of magic.
We all know someone that has diabetes or had diabetes, and it's taken too many of our youngsters and elders before their time. It took my mother at 57, and so we need to turn things around. And IDHC is doing that. By education, awareness of traditional foods and medicines, foot clinics, they're really working hard to combat this disease.
It is an honor to provide this address for the 25th year commemorative issue of the Indigenous Diabetes Health Circle's annual report. As always, I would like to begin by acknowledging and thanking our elders, Grandmother Renee Thomas Hill and Alan Jameson, for their vision, support, and sharing of knowledge and wisdom that has for many years contributed to all aspects of our programs and services. Part of our history includes the funding and collaborating in the development of culturally appropriate Indigenous healing, health, and diabetes programs, including a provincial diabetes strategy. It has been our honor to provide services to so many individuals, working with so many partner organizations, and to distribute so many resources throughout Ontario over the years. Many thanks always to the healers, knowledge holders, and service providers that work with our program. The information that we provide comes from these knowledge carriers and is woven through each and every IDHC presentation, resource, and program. On behalf of the IDHC Board of Directors, I thank the devoted IDHC team that is contributing to the world in a good way. Nyawa, miigwech, merci, and thank you to all of the community partners, our board, and our staff. The wisdom of our elders will reverse the epidemic of diabetes that we face together.
So in keeping with our traditions, the IDHC will be holding the shape of a circle. Moving forward, we're going to be carrying two bundles, the knowledge bundle and the client services bundle. We really look forward to building some solid strategic partnerships with each of you in your organization.
Cause it's strong enough. Know that you are strong.
The Foot Care program was initially started as a pilot project, as an answering to a call for proposals, and the model of care was created with guidance of our elders, and it became core funded in 2008, and I joined in the spring of 2008 as the Foot Care assistant, and just helped to grow it from there throughout the years of it providing services to the community. Some of the service providers that the foot care program initially started working with was chiropodists, foot care nurses, but they also worked with reflexologists. And a lot of our Indigenous practitioners are reflexologists as well, because there is that therapeutic touch and Indigenous component to the reflexology, and it allowed our clients to be comfortable with that particular service provider in taking off their shoes and socks, which they gained more comfort in seeing more of the medical professionals such as our foot care nurses and chiropodists. So the foot care program, when it first started providing services, it was mostly around Southern Ontario, and it worked to provide services within the community as clinics in the community in Southern Ontario. But in 2013, we answered a call for a proposal and submitted a proposal rather to the Ministry of Health to expand our foot care program, and we received the funding on a special project basis, and from there expanded our services to all of Ontario, and it really increased our reach as well as increased our service providers, the roster list, and the services that we offer to now all of Ontario to Indigenous communities. So a lot of the services that we offer are meeting that preventative foot care in preventing amputations. As we know, proper footwear that prevents concerns, treatment on concerns, possibly non-invasive surgical interventions are also known to prevent amputations. And those are some of the services that we offer. Not only do we offer preventative foot care with foot care nurses, but we offer the more advanced care with chiropodists. And then we also offer offloading devices and footwear that's going to accommodate the foot and not cause any more concerns. And within all of those services, we're able to prevent concerns, eliminate and treat concerns that are present, and therefore prevent a lot of amputations that may have happened otherwise. Well, since COVID, there's been a lot of changes within our society and within our culture. A lot of people are going virtual, and some of the things that we've been doing within our foot care program that I think we're going to be growing more into in the future is a lot of the virtual education and information to get it out there into the community, but growing and increasing our strength within our local partnerships for regular routine foot care. Not just our events where we would come in for a day. We're now looking at sustainable, strong relations in order to provide services to community members on a long-term basis, as well as assisting and building capacity within communities so that they can in turn run foot care programs themselves, and offering a virtual community network to be able to connect and have that support in building their own foot care program and foot care clinics in their community.
Blessed by the universe, 'cause nobody will believe you until you do it first.
The Knowledge Department was born in 2007, around the same time as the Foot Care Department. Shannon Van Every transferred from Foot Care to become the education coordinator. Her first big event was a 5-day workshop about diabetes wellness, nutrition, and movement. The foundations of those teachings became our 13 Grandmother Moons Diabetes Wellness Training. Soon the Knowledge Department started developing resources. At early events, they were flying off the table as fast as we could fold them. Several people have headed up the department, but we continue to be leaders in education, training, resource development, and research.
To succeed, you just gotta believe.
In 1998, the SORTI Board of Directors decided to do a regional approach to promote diabetes awareness and formed the Regional Diabetes Workers across Southern Ontario. Barb White-Eye was the Western Region Worker. Mary Pheasant became the West Central Region Worker. Peggy Manag was the Central Region Worker. And Carol Loff was the Eastern Regional Worker, where Rosalind Baird was our Urban Horseshoe Region Worker, who later became our executive director in 2001, where then I was then hired to replace her as the Urban Horseshoe Regional Worker. Years ago, our Canadian government banned all our ceremonies, our whole way of life, and even our traditional ways of living off the land and having access to traditional medicines. It wasn't until 1951 to 1973 where it became legal again for us to be able to practice these in public. So prior to then, everything was kept underground. It was who you knew, building those trusts on who you could access or know who to access. And so gradually we became to build traditional elders and practitioners a list that community could access. And at our head office in Thorold, we created an elders room where we supplied traditional medicines and teas for our community to access. Diabetes wellness and healing is not a simple solution. We know that through historical traumas and social determinants of health have a huge impact on that. But if you also look at our traditional ways of living in our healing ways, we know that's a very integral part of diabetes wellness healing today. Part of the diabetes awareness and prevention piece, we knew that we had to bring in the youth because it was important that they know what's going on. And so in 2010, we formed the Restore Pride youth program led by John Henhock and Marie Bowring. We put out a call to youth to submit either words, songs, poems on their experiences with diabetes or messages that they wanted to promote for the prevention piece. We had such an overwhelming response that we created a hip hop album with lots of songs and spoken word, and also graffiti art became a big piece of this messages created the youth. Also, we brought in Rick Smallboy, who was an Indigenous award-winning hip hop artist who came and mentored some of the youth. They went on a tour with the artists and went to different communities to promote these messages. In 2016, the Southern Ontario Aboriginal Diabetes Initiative became the Indigenous Diabetes Health Circle due to some structural changes, but also covering all of Ontario now, not just the South. So the regional workers now became 4 workers, the Diabetes Wellness Prevention Coordinators, who covered the North, the South, the East, and the West. We began traveling to northern communities with our foot care clinic to places like Attawapiskat, Eagle Lake, Thunder Bay, even Nunavut. And it was very interesting, and it was great meeting people and making those new connections. In 2019, COVID hit, and as with the rest of the world, IDHC had to provide programming virtually. We developed many different programs on a regular basis to provide that diabetes wellness messages to our communities throughout Ontario. We also helped our knowledge program provide frontline worker training. In past years, we always had an annual event where we went to different communities and were able to have these events. But in 2021, we had a virtual conference, which the theme was honoring our traditional foods. And so this message is that our traditional foods play an important part of our lives, and realizing that they are an integral part of our wellness. And also a piece of that is promoting and bringing awareness of food sovereignty and how that's also an important part of our lives.
As the years went by, SODI grew and diversified. As additional funding was allocated, more staff were hired, and head office required a larger site. Programming was expanded to bring a message for children and youth. Culturally appropriate and relevant resources were developed. What you see today is the culmination of many years of dedication, commitment, and vision of building and delivering programming and services by the people, for the people.
Out the slums, don't get down in the dumps, get pumped for this life. Come on, stand up and fight. Don't take it laying down or even think of tapping out. Tell yourself you're making it, don't think of backing out. Rise and shine like you were meant to accomplish something great. Don't listen to the hate, cause your fate is what you make, cause it's strong enough.
You know that you are strong enough. You need to know that you are strong.
With the help of the ancestors and all those that were dedicated, that came on board, each of us was chosen to guide the people in a healthier way. And so I'm very happy to be here today to share this message. And it is because of the water, and it is because of the fire, and it is because of our natural environment that I am well today. And I hope that you celebrate with us the 25 years of wellness, of the path of wellness.
As every human being that has ever brought greatness to life. Everything we need to succeed, you just gotta believe. You just gotta believe. If you need to see it to believe, just believe and you will see that what it is you dream can't be reality. All it takes is faith and desire to make it real. The sky's the limit, but it's really how you feel. Don't take no for an answer, not even from yourself. They say God helps those that help themselves, cause you're strong enough. You need to know that you are strong enough. You need to know that you are strong enough. You need to know that you are strong enough. You need to know that you are strong.
Personally, I would like to extend my sincere and grateful thanks to the Foot Care program for saving me from a potential amputation. Congratulations, IDHC, on your 25th anniversary.
A few years back, I think it was about 2009, I was asked to help out in the production of a youth hip-hop album to help to prevent diabetes. My late mom had passed away from diabetes, and it was really kind of a difficult subject for me. But working with SODI and the youth, it was an incredible experience.
So happy birthday, IDHC. It's 25 beautiful years, and I can honestly say that I've been kind of known about and been involved for many of those 25 years.
Wow, 25 years, IDHC. Congratulations on your 25th anniversary. I'd also like to extend congratulations out to the staff. You're doing amazing work. I'm so proud of you.
Happy 25th anniversary, IDHC. I've always been a big supporter of this provincial organization, and I'm a proud member of its board of directors.